My name is Brian Lee, and I am a transplant hepatologist at University of Southern California. I'm joined by Dr. Christopher Coe from University of California, Los Angeles, to discuss his review article, Pharmacotherapy for Alcohol Use Disorder in Patients with Alcohol-Associated Liver Disease, a brief guide for clinicians. So thank you for joining us, Dr. Coe.
Thanks so much for having me, Dr. Lee. It's a pleasure to chat with you.
So tell us about your article. Who is it geared towards, and what can they learn from it?
Yeah, this article is geared towards clinicians, geared towards anyone taking care of patients with liver disease. And in that population, there's going to be patients with liver disease who drink alcohol. And this paper aims to give those clinicians tools to safely use pharmacotherapy to treat comorbid alcohol use disorder in patients with liver disease.
So I hear, a lot from my colleagues, hepatologists, that they feel that addiction specialists should be the ones prescribing pharmacotherapy for alcohol use disorder. What do you think about that?
That's a great question. I think that ideally, we all agree that a multidisciplinary approach is best. This approach would involve hepatologists, social workers, addiction medicine and addiction psychiatry specialists. But the reality is that timely referral is not always possible. It is possible to teach clinicians how to safely use these medicines to treat underlying comorbid alcohol use disorder to improve outcomes, and that was our goal here.
So tell us then, what is your practical approach to prescribing pharmacotherapy in patients with liver disease?
Great question. It can be overwhelming when faced with these different options and the sick patient in front of you. Figure 1 in our paper tries to distill available professional guidelines and data into an algorithmic approach that focuses on whether the patient does or does not have cirrhosis. You can see by following the algorithm that in patients with compensated cirrhosis or who don't have cirrhosis, and by that I mean chronic liver disease without cirrhosis or Child-Pugh A or B cirrhosis, we give naltrexone as a first-line option. If there is decompensated cirrhosis, so Child-Pugh C cirrhosis, we don't recommend naltrexone, but we do recommend acamprosate, gabapentin, topiramate, and baclofen.
And are these medications, actually effective? Are there, robust evidence-based data to support their use?
There is emerging data supporting their use in this population. We know based on some recent retrospective data that patients who receive pharmacotherapy for alcohol use disorder who have chronic liver disease have fewer hepatic decompensations and may even live longer. We hope in the future that this data will become even more robust.
And I think there's a lot of fear from hepatologists. There's a very sick population. So are these medications safe, and how should patients be monitored on them?
Absolutely. So monitoring is very, very important. If you move on to table 1, once the clinician has selected an agent, there's lots of data summarized in this table that shows how to dose it safely. It gives some efficacy data as well, but also it really drills down into specific considerations in liver disease, potential adverse outcomes, and how best to safely monitor these patients on these medicines. Overall, we think that the available data suggests that these medications are safe, improve outcomes, and decrease mortality in this population.
And then finally, what is your take-home message for readers?
Our take-home message is just like when dealing with patients with any other cause of liver disease, the underlying cause of liver disease has to be managed and dealt with. In patients with alcohol use disorder, that's often the alcohol use disorder. As hepatologists, as clinicians treating patients with liver disease, we should know how to manage underlying alcohol use disorder, and we hope that this paper helps clinicians feel comfortable doing so.
Well, thank you for joining us, and thank you for writing this important piece, which is entitled Pharmacotherapy for Alcohol Use Disorder in Patients with Alcohol-Associated Liver Disease, which can be found online on Clinical Liver Disease. Thank you, Dr. Patel.
Thanks so much, Dr. Lee. It was great chatting with you.